A mere 42 degrees now at 8:10. Good morning. And in the studio with me, I have a guest. Andrew O'Grady is here. He's the Executive Director and CEO of the Mental Health America of Dutchess County. Hello, good morning.
Hi, Katie. How are you?
I'm pretty good. Thanks for coming in and making the drive here.
Of course.
So I got in touch with you because I got an item for the wall board, an event called Intersections, videos that people can see with information. And I thought, well, this is something that you might want to come on the air and talk about. And you may have some other events and things, but can we start with Intersections? What is it? What does it do? And how do people participate?
Well, Intersections was developed by Jim Ball and Dr. Larry Force. Dr. Larry Force works for Mount St. Mary College, and it's an intervention that's different than anything we've had before related to addiction. And the goal is to, which is not new, but the goal is to have a systematic way of moving people toward healthier activities, replacing the negative behaviors that are leading them into trouble, addiction, drinking, whatever it might be, and replacing that with more positive activities, yoga, movement, nutrition, that type of thing. So he had this series, he had this manual being built for this intervention, and he needed a place to try it. And he came to Mental Health America. I've known Dr. Force for a long time, and he came to me, and he said, "Hey, can we pilot this project within your organization?" And we have halfway houses in Poughkeepsie, Dowling House, Bolger House, and Florence Manor. There are halfway houses for men, women, and mixed. People in recovery, about a year to about 3 months to a year, clean and sober. So we put this program into those community residences. We've had great success, and we have evidence now that shows that it's actually working very well. Then COVID hit, and we had the idea that we would take that and kind of move it into a video platform that we share online on YouTube and also on our website, Intersections. You can look up Intersections Exchange on YouTube, and you can watch any of these videos. And we've had guests. We started off with guests locally, people in recovery, family members of people in recovery. It's a half-hour conversation. It really is. It's eye-opening to me, and I'm sure to the viewer. It's pretty incredible hearing the stories and hearing the impact addiction has on family members, people with addiction, people in long-term recovery, what their story was, how they got sober. And then it expanded. We had guests from Washington. We had guests from Seattle. We had guests from Los Angeles. We had guests from England, Ireland, and Australia. So now we're basically worldwide. I got to say, we're worldwide. It's pretty exciting.
You are, and that's very exciting. And what I got in the email that just caught me, it says Intersections Season 2, Episode 13 already. And I wasn't aware of this at all. So, wow. Episode 13 is called From Self to Peer, All in a Lifetime. And then Episode 14 is Stories of Hope. And people can watch these, and this is for families of those who are addicted, or the people themselves who have an addiction problem. Watch it. See how maybe there's a different way of thinking about the problem, a different way of thinking about your life.
Well, that's the way. That's what we focus on, and we make that point clear that there's a different path for everybody to sobriety, and sobriety can happen. And I can just tell you that, I've met countless number of people who, in my career, I've been doing this for 30 years, who have gotten clean and sober. And I knew them when they weren't. And I wish there was always a picture of them right before they got sober and a picture after they got sober. And it's pretty dramatic at times. I mean, the difference is incredible. And
that's just the visual, but what's inside of them is even deeper.
Inside, they feel phenomenal, and life is different and better. Alcohol is out there. People are going to drink it, and they're going to have a glass of wine, whatever. But when you have a problem with alcohol or drugs, and it's impacting your life negatively, you're not waking up for work, you're losing jobs because of work, your relationships are impacted. That's the time to really look at whether or not this is working for you, and try to stop. And these videos can really, they're really, some of the stories are unbelievable. We have, I don't know the name of the episode, it was in the beginning. This woman from, she worked for Nike. She was 35 years old, had like a $300,000 job, working in a penthouse suite in Seattle. And then she admitted she was doing cocaine basically her whole life. But that helped her feel grounded and stable. But then cocaine wasn't working for her anymore, and she decided to try crack. Somebody turned her onto it. Within a week, she was in a crack house, sleeping on a mattress. She didn't go to work. She lost her job. She lost everything. And she was addicted to the drug. So there are some drugs out there that are extremely addictive. And, that's when people go down that road, that's pretty bad. I was listening to NPR, one of your stations, this morning, and they were talking about the heroin problem and fentanyl. And it's really a problem in our communities all over the country. But there's a pathway to sobriety. And this is just one tool in the tool belt. And I encourage anybody, when you say it's not just for, family members, let's be honest, we all know somebody in our life that has a problem.
I'm thinking of a friend of mine right now who her son, she worries about him every single day, and she sends him messages on Facebook. I love you, I accept you, but I'd really like it if you'd look into this program. I'd really like you to just come back to me as you used to be.
Yeah, it's very sad. I held a support group for family members of people with addiction. Mm-hmm. And boy, they really needed that. We'd have about 15 people at a time, and they would just talk about their family members and the struggle. And when do you cut them off because you think that's the right intervention? When do you hold them close, but people are going to say you're enabling them? So what's the right intervention? I've seen terrible outcomes both ways, so you question yourself no matter what.
As you said, there's no one-size-fits-all approach.
No.
That it has to be individualized every single time. So that's why you have a series of videos here that maybe one of them will be the right one to reach each person. Maybe that's...
It works. I mean, there was a woman in Orange County here who was a guest on our show about 3 weeks ago, and she sent me an email. I want to pull it up and read it to you, but I don't want to waste our time there, obviously. But it was an amazing email. We got it yesterday, and she said that someone called her because they always give their contact information. People that are on our show in recovery love to give out their personal information because they want to be available to anybody that calls. That's the greatest thing about people in recovery.
Oh, yeah. They're willing to help.
They're willing to
that.
help.
Wow.
And somebody called out of the blue and said, I watched this show and I really want to get clean, and I'm giving you a call because it was tremendous. And you seem like a wonderful person, and can you help me through this? And she touched somebody. So one life, that's all that it takes. We just want to make a difference.
And it sounds like you are. So now, where do people go to see Intersections?
They can, the easiest way is probably, you could either Google Intersections Exchange, or you could go to YouTube and type in Intersections Exchange. We have our own YouTube channel, and you can click on a channel, and then you'll see all of the different... You'll see all of our different series and episodes.
Okay.
So it's been going on for about 2 years now. We probably have.
Boy, it took me long enough to hear about it. Okay. Yeah. Well, we will help you get the word out further too, because this is really wonderful. The work that you're doing, Mental Health America of Dutchess County. Let's take a quick break. We will be right back with more with Andrew O'Grady from Mental Health America on Wall Radio. The Hudson Valley's hometown station is Wall Radio. That's where you are. It's 8:21. And with me in the studio, Andrew O'Grady from Mental Health America of Dutchess County. And we're talking about their program Intersections, a series of videos of people's stories getting clean of addictions, and how there are many different approaches to help people. So now, during the commercial break, we were talking here, and I told him I wasn't sure if I should say this, but when my kids were little, I told them, here's what they're not going to say to you in school about drugs. Drugs are fun, but it's only temporary fun. And after a while, you can't have fun anymore without them.
Yeah.
but their friends tell them only the fun part. And that makes it so easy for somebody who just doesn't realize to fall into addiction. And,
Absolutely.
oh, that's so painful to see. And you know, you worry about it with your own kids. I know people who have lost a child. And,
well, people don't die from marijuana or, heroin kills people. Heroin is a very bad drug, and you want to stay away from that. And that's why pain pills, playing around with pain pills is really dangerous, because when you can't get them anymore, you actually have a physical withdrawal and a physical craving for it, and then you seek it other places. And that pathway is a really bad one. But, people who smoke marijuana all the time. And this is not true for everybody, but for the majority of the people, if you're doing that all the time, you are just a little less motivated than the next guy. You're a little less driven than the next guy. You're chill, but it's not moving you anywhere. And you see those commercials sometimes, which, a bit of an exaggeration, but not that much of an exaggeration, where the guy's in the basement of his parents' house playing video games, and he's 46. He's been smoking all the time. He doesn't want to do anything more than that. So there's a lot of problems, and you're right. I've many times said I haven't tried cocaine or other drugs because who knows? Maybe I like it. I said that in college. I don't want to do that because who knows what'll happen. People don't do it because it messes them up. To your point, they do it because it's fun and it feels good for that moment.
Nobody says, "Oh, let me try this so that I can lose everything and live on the street."
Exactly.
Of course not. But if it happens and they fall into it and they can't find their way out on their own, you're reaching out to them.
I'm reaching out saying, you can check our videos out. That's a free resource for you. Our agency in Dutchess County, if you're listening from Dutchess County, we are a place that you can call, 473-2500, and we will guide you to your best path for recovery. And there are many amazing organizations in Orange County, Access Supports for Living and RSS. These are great. Lexington Center for Recovery. There are great not-for-profits that are ADAC that are all waiting here, looking to help anybody that needs it. So finding and accessing mental health and addiction care is not easy, and I'm embarrassed about how difficult it is. I've been doing this for 30 years, and I'm not proud that we have a system that doesn't exactly work and isn't as welcoming. You can't just call up. You have to, and insurance, does it cover it? Does it not? Is there a waiting list? And then for people with addiction, I can see you next Tuesday. Well, I'm going to get high 7 more times between now and next Tuesday. Hope I don't die. I mean, there should be immediate access. So, I'm working with my partners, the agencies I just mentioned, and we're working on a state level to try to, better that access to care. But there are a lot of great not-for-profits out here, and we're all willing to help. And so give us a call, any of us, and, you'll find that there are people out there that want to help you.
And it's something that has to be done one person at a time. You can't get an auditorium full of people needing your help. It has to be one at a time. So if they will reach out to you, you'll talk to them, you'll listen, you'll help, you'll treat them like an individual.
We like to say at MHA that our mission actually says we'll help the Hudson Valley with access to care without jumping through unnecessary hoops. Anybody listening that's ever tried to access mental health or addiction care may have found that there were unnecessary hoops they had to jump through, and that really bothers me. But we will stay on the phone with you. We will figure out what the best path for you is, and if we don't provide it, we will get it to you. We will figure out how to get you there. You're not going to be told, "No, got to call this number and see you later." That's just not acceptable.
Yeah. Please hold for the next 20 minutes. And don't forget, your call is very important to us. No, not going to happen. All right. That phone number again is 473-2500. Don't forget to dial the 845 first. That goes into effect Sunday.
Oh, boy.
Oh, right. Yeah. I'm just glad we don't have rotary phones anymore.
Oh, my gosh. Remember that? That was a zero. It was like, oh, no, the zero. That's going to take a long time.
Yes, it was. Yes. Or mhadutchess.org. Yep. And you work in Dutchess County, but if someone was listening and they weren't sure where to get help, you just heard him reel off a whole bunch of names for Orange County. Could they call you for help in other counties?
They could call us from anywhere. We have a woman, a resource coordinator. Her name is Marge Tortorella. She's been doing this work for us for years. She's a nurse. People say that she will turn over every rock and figure out what the best plan for you is. She's helped people in other countries. So call us from wherever you are. She'll guide you and get you in the right direction.
That is a wonderful message. Thank you so much.
Thank you.
Wow. The time just flew. You look at this, it's 8:27 already. I thank you for making the drive here and coming on with us this morning. You're doing great work. Please stay in touch and keep sending us information. We'll post it on the wall board. We'll put links on our website, and we'll help you as much as we can at Wall Radio. This has been Andrew O'Grady from the Mental Health, I keep saying from Mental Health America of Dutchess County. There, I got through it that time. Does most of your work consist of helping addictions?
No, we have.
But wait, there's more.
There's a lot more. I mean, that's just a small part of our agency. We do community-based care management. We have a clinic. We work with the homeless. Just check us out on the web and look at all the services and programs we offer. It's quite a bit. And we also manage the mobile crisis team in Dutchess County. So if you ever have a mental health emergency or somebody you're concerned about, you can give us a call and we will go out to the house immediately and check on them and make sure they're okay. Because
like you said, the family members are often saying, well, if I do this, it'll be wrong. But if I do the opposite, that'll be wrong. If I do something in the middle, that'll be wrong. If I do nothing at all, that'll be wrong. And it's the family members often need the reassurance as well. Of course, absolutely. And I'm pleased that you're offering a place for them to come to. Okay, thank you again for being here. I guess we have to stop, and it's time for a CBS News update from Wall Radio. It's 8:30.